Doctor is in the house today.
Dr. Zorba Paster is here to answer your questions. If you have a question, the number to call is 270-9933. Great day to call. The lines are wide open. Hi, Zorba. Good to see you. Happy New Year.
Happy New Year.
You're a little under the weather today.
I am. I've got a cold, and I wonder, why do I have a cold? Just because I see sick people all the time.
Exactly.
Do I have a cold? So let me tell you what I do for a cold. First of all, nothing cures the cold.
Right, time.
So time. That's right, actually time. So I don't take an antibiotic. That's really important because we overuse antibiotics. But number one is hydration, because when you have a cold, you don't feel like eating and drinking. And so I usually end up eating fruit juices that have vitamin C in it. So that's number one. Number two, I take Tylenol, also for aches and pains. If I really ache a lot, then I may take some ibuprofen. I make sure that I get enough sleep. So it's really, I'm a night owl. It's really hard for me. I try to go to sleep early. And then, once again, I know it's going to take time, and I'm always anxious. I want to get over it right away, but it's going to take 3 to 5 days or 6 days.
The problem with these colds that are going around is they are lingering for so long.
That's right.
That when do you know it's time to see the doctor?
When the other people living with you say, oh, you mean you've got to go see a doctor. That's about what it is. You never, if you develop a fever greater than 101, you should see a doctor. If you've got really mucus coming out of your nose, it's not getting better. If you've got chronic lung disease and you're bringing up a lot of mucus, or you feel like you're short of breath, you should do it. If you have diabetes and medical problems, that's kind of where it's at. And influenza is in the area.
A cold can lead to other things, then.
Absolutely. You can have a viral infection, and then you get a bacterial infection on top of that. But that's often accompanied by a fever, chills, and other people saying, hey, you know what? You really look bad. You ought to go see somebody.
A lot of people have it.
Oh, you're not alone,
A lot going around.
Yes, they do.
All right, let's go to the phones. We'll start with Janice in Janesville. Hi, Janice. What's your question?
Hi. My feet swell and my ankle is swollen bad, and no one knows what's causing it.
Well, first of all, when you've got pedal edema, which is where your feet or your ankles swell, it can be caused by a lot of things. It can be caused by problems with your heart, such as heart failure. That can be one cause. Other causes that you can also have are things such as sodium in your body can be off, but there's so range of problems when you have swelling in your ankles and your feet. Hard thing to answer over the telephone, but something that certainly you have to look at by your doctor. One thing that people often do, and they'll often wear support stockings, and that often is a very easy cure if you simply have ankle edema that just happens from the fact that you're sitting around too much and not exercising.
So it might not be that bad.
Might not be that bad, but something that I think you really should discuss with your doctor. That's a very important thing.
Okay.
All right, we have a call on too, but I don't know who it is. Here we go. All right, Fred in Verona. Hi, Fred. What's your question?
My question is, I take a blood thinner, and he seems to be doing something else. But anyway, I take a blood thinner, and once in a while I get blood in my urine.
Well, first of all, that's one of the side effects of blood thinners. All the blood thinners can produce blood in the urine. But anytime anyone has blood in the urine, it's important to talk to your doctor. And the reason is sometimes that's a symptom of something more serious, such as kidney cancer, prostate cancer, bladder cancer. So it either can be a side effect of the medication, or it can mean that something else is going on. Anytime you have blood in the urine, you want to find out what it is, stone, infection, you got to have it checked out.
Okay. All right. Let's go to Lori in Portage. Hi, Lori. What's your question?
Hi, I have a question. I've had a very dry cough for about 8 weeks now. I've been to the doctor several times, and I've gotten checks, x-rays. Everything seems to be clear and great. I've tried cough medicine. I'm on medications from my doctor, and nothing seems to touch it.
Are you on any blood pressure pills, something called ACE inhibitors?
No.
No, okay, because they are a common cause of a dry cough. Sometimes a dry cough can be the result of a medication such as an ACE inhibitor. Sometimes it can mean that you're developing reactive airway disease, almost like an allergy. Sometimes a steroid inhaler that you use maybe for a week or 2 weeks and actually get your lungs to calm down so that cough can disappear. I mean, there are a number of different things you can do. The steroid inhaler often works for people where we just can't figure out what's going on.
Okay.
All right. Let's go to Ellie in Madison. Hi, Ellie.
Yes.
What's your question?
I heard Dr. Zorba talking about swollen feet and sodium, and I had my feet were swollen really bad once, and the next day I had a heart attack, and I was told that was warning sign.
Well, swelling in the ankles can be something very serious, and that's exactly what we talked about. It's not specifically a warning sign for heart attacks, but it can mean heart failure, and that can be a symptom of it.
All right.
All right, let's go to Dan in Lodi. Hi, Dan. What's your question?
Yes, Dr. Zorba, I'm the same age you are.
Good.
And remember we used to
You're
go
still
out,
alive.
if we went out drinking, we said we were going to go out and kill some brain cells. I think, in my own opinion, the people that I know now that are having problems with their memory did do heavy drinking and still are. Is that a possibility that drinking may be associated, heavy drinking, with a loss of memory?
There's no doubt about it. There's no doubt about
Really?
it. One of the causes of memory loss, besides Alzheimer's disease, cardiovascular disease, can be too much alcohol. There's no doubt about it. That is one of the things that that can actually cause dementia and can cause memory loss. And that's why we recommend 2 drinks or less for men, 1 drink or less per day for women. Obviously, binge drinking is out, but that's where drinking is really an issue, especially in Wisconsin, where drinking is a part of our culture. We believe we can't have a good time unless we're going out and having some alcohol. And I think it's important, especially for older adults, to realize, hey, maybe the time has come for you to actually have a non-alcoholic beer, and there are good non-alcoholic beers out there now, more than we ever had before.
So older people are affected by alcohol at a higher level, or just
Well, I
build
just
up
think
over time?
It's just over time. It's not necessarily a higher level, but just over time it can do you in.
All right. Well, feel better?
Thank you. I will try. Maybe that'll make me feel better. See, you're my doctor.
Thanks for calling in, everybody. We'll do this again soon.
Zorba, great to see you.
Good seeing you.
Happy New Year.
Feel better. Happy New Year.
Right back with the final check of your forecast.
Ready to roll playback?